Welcome to this lecture on internal controls in healthcare and insurance. In this session, we'll explore how internal control systems help healthcare organizations and insurance companies manage risk, ensure compliance, protect sensitive data, and maintain operational efficiency. The healthcare and insurance industries are complex, highly regulated, and data-driven. They involve vast networks of patients, providers, policyholders, and regulatory bodies. Internal controls are essential in these sectors to ensure accuracy in financial reporting, safeguard assets, protect patient information, and comply with healthcare laws. Let's begin with the objectives of internal controls in healthcare and insurance. 1. Ensure compliance with healthcare regulations such as HIPAA, HITECH, and the Affordable Care Act. 2. Maintain accuracy and integrity of patient and policyholder data. 3. Prevent fraud, billing errors, and claims manipulation. 4. Safeguard physical and digital assets. 5. Promote efficiency, transparency, and accountability across all operations. Now, let's explore how internal controls apply to key areas within healthcare and insurance organizations. 1. Healthcare and insurance companies handle large volumes of sensitive personal data. Access restrictions based on job roles to protect electronic health records, EHRs, and insurance databases. Encryption of data both in transit and at rest. Audit trails that track who accesses or modifies records. Regular data integrity reviews to detect unauthorized changes or inconsistencies. Compliance with the Health Insurance Portability and Accountability Act is critical. HIPAA requires administrative, technical, and physical safeguards to protect patient health information, PHI. Violations can lead to severe legal and financial penalties. 2. Billing and claims are high-risk areas for errors and fraud. Common issues include duplicate billing, upcoding, and processing claims for ineligible services. Automated claim validation systems that flag inconsistencies. Segregation of duties between claim submission, approval, and payment. Periodic audits of billing and claims transactions. Reconciliation between submitted claims, payments, and general ledger entries. In insurance, automated controls verify policy coverage, eligibility, and claim validity before payment approval. Predictive analytics and artificial intelligence are increasingly used to detect fraudulent patterns. 3. Healthcare organizations rely on timely procurement of medical supplies, equipment, and pharmaceuticals. Vendor approval and qualification processes. Three-way matching of purchase orders, invoices, and receipts. Real-time tracking of medical inventory to prevent stockouts or overstocking. Controls over controlled substances to prevent theft or misuse. Pharmaceutical inventory management systems often use barcoding and RFID tracking to ensure accurate stock control and compliance with the Drug Supply Chain Security Act, DSCSA. The revenue cycle in healthcare, from patient registration to payment collection, involves multiple stages that require strong controls to prevent leakage and ensure accuracy. Verification of patient eligibility and authorization before service. Reconciliation of patient accounts with payments received. Segregation of responsibilities between charge entry, billing, and collections. Review of adjustments and write-offs to detect irregularities. In both healthcare and insurance, financial reporting must comply with accounting standards and regulatory requirements. Automated reporting systems, reconciliations, and approval workflows enhance reliability and reduce human error. Regulatory compliance is a top priority. Healthcare and insurance organizations must adhere to standards from entities such as the Centers for Medicare and Medicaid Services, CMS, the National Association of Insurance Commissioners, NAIC, and state health departments. Compliance controls include regular internal audits and compliance reviews, policy and procedure updates in response to regulatory changes, employee training programs on fraud prevention and data security, whistleblower and incident reporting mechanisms. Healthcare and insurance organizations are prime targets for cyber attacks due to the value of health data. Strong IT controls are vital to prevent breaches and ensure business continuity. Multi-factor authentication for system access. Regular patch management and vulnerability assessments. backup and disaster recovery systems to maintain data availability, continuous monitoring of network traffic for unusual activity. Let's consider a practical example. A large hospital system discovered recurring duplicate payments to vendors. An internal audit revealed that invoice approvals were being bypassed due to system misconfigurations. The organization implemented new ERP controls, requiring dual approvals for high-value purchases and automated alerts for duplicate invoice numbers. Within months, payment accuracy improved dramatically, saving millions annually. Similarly, in the insurance sector, a company used AI-based monitoring to identify suspicious claims. The system detected several fraudulent cases involving repeated injury claims, leading to major cost savings and improved regulatory compliance. To summarize, internal controls in healthcare and insurance are critical for maintaining integrity, compliance, and trust. From safeguarding patient data to preventing billing fraud and ensuring accurate financial reporting, these controls protect both organizations and the people they serve. As technology evolves, automation, analytics, and cybersecurity will continue to shape the future of internal controls in these vital industries. In our next lecture, we'll explore emerging trends in internal control, examining how innovation, digitization, and global regulation are transforming control frameworks across all sectors. Thank you for joining me in this session on internal controls in healthcare and insurance.